This is a quick video response to Matthew Siegel on this video. And I feel almost obligated to say something about this, so I'm going to go ahead and do it. I don't think it's a good idea to use this substance in a clinical setting. And I'm not a drug law advocate. And I'm not someone who thinks that this isn't a useful sort of experimentation. But I think that the circumstances and the situations that it's used under need to be more carefully considered. I don't think it's something that is a good idea to try to treat patients with. And I know that there's sort of a tradition in some shamanic schools about this with ayahuasca and other sorts of experiences. But specifically, my concern about it is that it's, even if the theory about what what it does is true, I don't think that that is a position in our society that everyone is prepared to deal with. In other words, that sort of knowledge, there's a seal on that sort of knowledge sometimes for a reason, and I think that breaking that seal can be potentially problematic. Now, I'm not going to get into the details here. This is not something I wanted to talk about on YouTube, but I wanted to voice my concern about this as being used in a clinical setting. And if you're considering doing that, Matt, I would sort of discourage it. Now, there are other settings that I would encourage you to experiment with under, but that is not one of them. I don't think that you can say, well, you're going to have to be in this room for this amount of time with this person and do this and all that. I don't think that you can put those sort of constraints on that experience and have it turn out to be consistently helpful. And my concern would be, especially using this with people who have some sort of psychiatric condition or emotional problems. I don't think that's a good idea at all, because they're less likely to be able to, in my view, less likely to be able to handle the circumstances, what they might discover, which can be very, very good and interesting. And under certain circumstances, if you're initiating a shaman or something like that, if you're intending the person to have that sort of role, or you're wanting to initiate that sort of thing, then that use is valid. Or if you're doing some sort of journeying, a specific journey or something like that. But like I said, I'm not going to get into the details about my specifics on this, but I'm not sure that this is a good idea for a clinical setting, and so please be careful.